Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller. And today on the Get Healthy Tampa Bay podcast, I'm joined by Dr. Gloria Esoimeme. Welcome to the podcast.
Thank you for having me, Dr. Reller.
Yeah, so Dr. Gloria is an internal medicine physician with a master's in global health and a PhD in health services policy and management. She's also a coach and a speaker who helps women lead confidently, negotiate their worth, and build balanced, fulfilling lives. Dr. Gloria's own story is remarkable. She left Nigeria with $250 and a visiting visa, and within 10 years achieved her dream of earning a master's, a PhD, and completing residency. Today, she's joining us all the way from Dubai to talk about the power of grit, pursuing your dreams, and ultimately finding contentment in the process. So, Dr. Gloria, welcome to the podcast, of course. And you've described, grit as a cornerstone of your journey. How would you personally define it?
Ah, Thank you so much for having me on your podcast. And thank you for that warm introduction. And yes, I did leave Nigeria with $250. Thinking about that now, I'm just wondering, what was I thinking? Like, I got on the plane with just $250 and I had all these dreams. But that's what led to me developing grit. But I think prior to that, just going through medical school, that's something medicine would teach you. Like for my colleagues who train in the US, you know what it took you to study for the MCAT, right? Before the MCAT, you know what it took you to have the GPA you had for you to get into med school and then study for the MCAT. You know all the tears you cried, the times you took the test, it didn't turn out as great as you thought it was going to turn out, and then you kept pushing and then finally you got into med school and you're like, oh my God, thank you. Now I'm in med school. And then the journey starts all over again, right? So that's what I would call grit. Grit is that staying power. That's that ability to keep going and you just keep going. But it's not a gift, right? Grit is
Mhm.
not a gift. It's something, it's a muscle that's developed over time. So let me just tell my story, just so as I tell my story along the way, we would see how grit comes into play and then how you can become content just because you've developed grit to pursue your dreams. So back to when I was in Nigeria, I was in my 20s when I finished med school and I remember being in the children emergency room and I was talking to a patient, a child and her mother, and I was done taking my history. And then another of my classmates was taking a history. I could hear what they were asking because it was the ER. And they said something. I said, okay, I know they're going to ask this question next. And they did. I said, okay, they're going to ask that question next. And they did. I said, they're going to ask this other. I was like, okay, I don't think I can do this for the rest of my life. It's too predictable. I want something that's a little bit different. However, I love being a doctor. Now that it's like the highest calling of my life to take care of patients, to have people trust me with their health. But I knew I wanted more than that. I didn't just want something that was very predictable. And then I was thinking, okay, so what can I do that's a little bit different? And then looking at the country where I was born, where I'm from, I said, okay, maybe public health would be a good option. I can do research, I can work on health systems to make things better. And then I said, okay, what do I need to, so where do I want to do my, where do I want to, what education do I need? What more do I need? I said, okay, I'll get a master's in public health. And then I looked at all the universities around the world. I'm like, I don't want to go to the UK. I'm like, well, America, that's the that's the dream. And I said, okay, I'm gonna move to America. And it was everything I did just moved towards moving to the US. And I knew I did not want to ask my parents for my tuition. And even if I ask them, because when you do the exchange rates between the current, the local currency in Nigeria and the US dollars, they might have to sell my younger brother or someone for them to to pay for my tuition cash because my dad was already retired. He had sent me through med school, so there was no way I was going to ask for that. But I didn't stop. I didn't let that stop me. I knew I wanted that dream. And what I did was, okay, so what's the first step in if I want to move to the US? I want to get a master's. What's the first step? The first step is to write the GRE that I could afford. So I'm like, okay, I'll pay for that. I paid for the GRE. I did the exam. I didn't like my score. I'm like, I want to go to Harvard, right? I'm like, no, this score will not take me to Harvard. So I did the exam again. I scored maybe like 50 points higher. It still did not meet the mark. I'm like, whatever, I'm not going to take this exam anymore. I just need to, I'm like, okay, if I don't get Harvard, I'll get Boston University. Best decision of my life ever. And so I took the GRE, went through the whole process of applying, waited a few months. Finally, I didn't get into Harvard, but I got into Boston University. But before I got into Boston University, I had done, there are like if in Nigeria, once you're done with med school, you need to do 1 year of internship because you don't have to do residency to practice. And then after your 1 year of internship, where you go through the four major specialties, you do pediatrics, rotation, 3 months of peds, 3 months of IM, 3 months of surgery, 3 months of OBGYN, and then that way you have some experience to really care for patients. And so I did that. And then after that, you have to do 1 year compulsory service to the country. So I did that as well. But that I did in a public health institution just because I knew what my plan was. So I spent 1 year there. And so when I was done with that 1 year, I didn't have my admission to Boston University. I just knew Harvard did not give me the admission. I'm like, well, I'm moving to the US. I already made up my mind. And then I had a visa because I had visited the US a few times before. So I had my visa. And I had sisters who were in the US military, but they were deployed at the time. So I said, well, I'm moving to the US. And after I paid for my flight and everything, I had $250. I was like, yes, I'm getting on that plane. I got on the plane and then I arrived at the US with my visiting visa. And then finally, Boston University gave me admission. They gave me some scholarships. And when they gave me they sent me, there's a form they sent to you. It's called, I can't remember the name now, but the form, it shows you how much in quotes, your tuition is. And then it tells you how much you would need. So what was there was like $40,000. I was like, oh, that's a lot of money. But I got scholarships for like $10,000. And then I reached out to my sister, applied for a student loan. She co-signed, and then I got to school. You know what, Kerry? Sometimes when you're going on a journey, what I would advise anyone is have an idea of the big picture of where you're going. Because sometimes when you know all the nitty-gritty of what's going to happen along the way, you're going to stop. Because if I knew everything that happened in between, I think I would have stopped. So I got to school. I was just happy. I'm in Boston, this beautiful city. I had friends. It was just amazing. And then one day I was talking to one of my colleagues who was also an international student, and he said, "Yeah, you know, the 40,000 was just for the first semester. We have to think of the second." I said, "Wait, that's not for the whole program." He said, "No." So, well, I was just like, you know what? I'm not gonna sweat it. What I'm gonna do is just be, because I said, well, I'll figure that out. And I just continued with school. I was just still, I was just still on campus and all of that. And then I remember it was close to the end of the first semester. One of my professors, she called me, God bless her, she's an angel as far as I'm concerned. And she called me to her office. She said, "Oh, Gloria, I read your e-portfolio and I was just so touched." And I'm wondering, why was she touched? Because we had an e-portfolio where they said, what are the three things that bother you the most? Is it your relationship? Is it school? Or is it finance? I said it was schoolwork because I had just moved to a new country. I was trying to make friends. At the same time, I had to study. I wasn't used to the system. Just trying to wrap my head all around that was a challenge. So I was wondering, why was she touched? That was just me being a lazy student or someone who wants to just, get everything at the same time. She was like, no, 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 no. I was so touched. I'm like, okay. And then she said, okay, so what's your problem? I said, I really don't have any. And finally she said, okay, Gloria, how are you going to pay your tuition? I was like, oh. I said, well, so I explained the whole situation. She was like, oh, okay. And then I left. Then I remember the next semester, it was close to the time to pay our tuition. I was like, I don't really know how I'm going to pay my tuition. So I reached out to my sister again. I said, oh, are you going to co-sign another loan? She was like, well, Gloria, I think I've reached my limits. I can't sign another loan. And then I went to my portal. I saw they had given me scholarship. And all I had to pay maybe was like 100. It was less than $500 I had to pay as opposed to 20 something thousand dollars. And that happened again in my third semester. I knew it was that professor who had looked at my grades, looked at my whole package, and then put in a word for me. So I got scholarship. And so if I look at that process, Kerry, if I had sat down back home in Nigeria and said, oh, I had these dreams, because I have friends who had the same dreams that I had, and they were in the same situation as I was, they didn't have the resources for it. And some countries are different. Like in the US, you have access to loans, which you still have to pay back with interest. So it's not free, but
Mhm.
you have that option. But in some countries, you don't even have that option. It's either your parents pay for it. Because I had classmates who their parents were really rich. They didn't have to sell any sibling, but they were able to pay for their for their tuition. I didn't have that. So I had friends also who didn't have that. So they didn't take that step. So
Mhm.
what I would tell anyone with regards to grit is, or pursuing your dreams, is the first step, you just need to take that first step. Have
Mhm.
an idea of the big picture and then take that first step. The first step for me was to write my GRE. I think it was maybe, I don't think it was up to $250 for that, or 100. I can't recall how much it was. It was a long time ago, but I knew I could afford that. Because sometimes when you want to start a business or you're going into a big venture, you're like, oh, it's going to cost me $2 million. It might actually cost you $2 million, but the first step is not $2 million. You don't have to spend $2 million the first day. The first day might just be $20, or it might be $1,000. So sometimes we look at that whole picture and then we get overwhelmed. You're like, I would never achieve this. But when you divide it into, you have the big picture and you say, what can I do today to move the needle forward? Then that
Mhm.
keeps you going. And once you do that, the next day you say, what can I do to move forward? And people think to move on in life, they need finance. I don't think so. I think the first thing you need is an idea, and then be committed to the goal and say, you know what, I'm not going to give up. And once people see you pushing, then help usually, just based on my experience, I would say help comes once you go on that journey, right? So that's the first part of my story of how I moved to the US with $250. And then I was like, oh, I need to get a master's. And I did. But I had loans when I was done because I still had to pay my sister for the loan I got from her. And then the next thing was I said, okay, I need, because the plan was get a master's, get a PhD, and then the residency part. Because I don't know if you're aware of that, for those of us who in school in the US, still have to take the USMLE. And
Mhm.
it's very different because medicine is the same everywhere, but the training we had is specific to the tropics, right? The training we had was specific to our community, to the resources that we had. So it's like, so now you have to learn it's still, you have the foundation, but you have to learn it all over again. So I was in my master's program. I got into my PhD program. That was a lot easier because I knew the system and all of that. But it was now, how do I combine all of this studying that I'm doing for this process and still study for my USMLE so I can get into residency. And so what I did was, it was still the same principle of, okay, so what can I do today? How can I be more strategic? And so what I did was I decided to take on a lot of all my coursework in my PhD program. So what I would have spread over 3 years, I did it in a year and a half. I said, so if I do this in a year and a half, then I can give myself a few months to study for my step one and step two. Then I can do my research and then move on to residency. So that's what I did. But at that point in time, my life was a lot easier. I had learned how to use Epic EHR. So I was traveling to teach people to teach physicians how to use Epic. And so I was getting paid. So I was not as broke as I was when I started. So and that's just part of life. Once you start to move, you start to make traction, then you start getting resources. The more traction you make, the more resources you have. And people would think that people would want it to be that it's when you don't have, that's when people would give to you. Unfortunately, just the way life is structured, people give to people who have. I don't know if it's fair. I don't know if it's right. Let me ask you a question. You tell me what your thought process is. So the CEO, let's say you work in a hospital system and there's a CEO and you're friendly with the CEO and you know it's her birthday. So when you want to give the CEO a gift, what would be your thought process?
Like, should I give them a gift?
Yeah, you're like, what would be the thought
No.
process?
I'm not much of a gift giver. I give you a nice
But
card.
right, but you're going to think through, right? You're going to say, oh, what would be a good gift for this person, right? And that person
Mm,
truly does not need that gift, to be honest,
right.
because they can get themselves everything that they need. But if you're driving down the road and you get to a stop sign and there is a beggar, if you take $1,000 or $500 and you give to that person, you're going to be like, I really did a lot for this person today. Or, even if you give $100, like, I just gave him $100, right? However, if you give the CEO who doesn't really need that resource $100, you're not going to feel like, oh, I gave the CEO $100. You're like, so it's that principle in life that I don't know if it's right or if it's wrong, but it's just what it is. And
Mhm.
personally, I try to go with the tide. I don't go against the tide. And if the water is not flowing in the direction of where I'm going, I would get out of that water completely and get in the water where I can get on the tide that would take me towards my destination. So I know that's a principle in life that when you don't have, the more you don't have, the more you won't have. And the more you have, the more you have. And that's just what I saw. Like the more resources I had, the more resources I continue to have. And I tried as much as I could not to have that scarcity mindset. It's hard when you don't have, but there's a difference between not having and then having the scarcity mindset. So my point there is, let me go back and just do like a quick recap so people understand what I'm saying is, so when I started with nothing, had just $250, but I didn't stop, right? I was still in school. I didn't sit back and say, okay, now that I don't have the resources for it, then I'm going to act like I don't have the resources for it and sit back. No, I took steps forward. The little resources I had, I put it into what I believed in, and then I moved on. I took that risk of moving to a different country, and like what I tell most people about myself and people who I coach, I tell myself, what's the worst that could happen? The worst that could happen was I would not get the money for my tuition. I would be kicked out of the country and I would go back, but I would know I tried. There would never be a what if. Now it would be I went, but the resources wasn't really there and I had to go back home. But now it's a different story. So it's just not having that scarcity mindset, even when it's scarce, and then just to keep going.
Hmm. Would you say, so I like to think of grit, or other people might think of grit as like driven or having goals, and things like that. Would you say
Yeah.
that that stuff is teachable or learnable, or is that like ingrained in you?
I think grit is different from having goals because you could have goals. Every people have goals, and you could have goals, but if you don't work towards your goals, grit comes in the process where you're working towards your goals. And
Mhm.
yes, you can learn. It's not a gift. You're not born with grit. It comes with practice, right? So okay, now I live in the UAE. So people ask me, "Oh, Gloria, you are not scared. You just packed your bags and you moved to the UAE." I'm like, I've done it before, right? So it's not a new muscle for me. It's a muscle I've worked over time. So moving from the US where I lived for like 15 years, I got used to the whole system. That felt like home to me. And then moving to a new country, I was just like, yeah, okay, I want to move to Dubai. Oh, I'm gonna do it because I've done it before. So it's something that you can learn. And you don't have to start by moving to a new country if you haven't done that before and say, oh, I want to learn great. It just might be, oh, I want to read one book a month,
Mhm.
and then you read that book a month, or and you just keep going. And most people feel like once they so you have this list of things you want to do in a day, you have 10 items on that list, and then you only check two, and then you wake up in the morning, you're like, oh, I don't have grit, right? So you're like, oh, I don't have grit, I'm just going to give up. No, you keep fighting. It's an ongoing battle that you keep fighting. You look at the list. Oh, I checked two items. You're like, well, I'm good, I still have eight. Then there's tomorrow, right? So when I wake up every morning, I'm like, oh, thank God for today. I can accomplish the things I didn't accomplish yesterday, so I can add those to my list. And you keep going, you keep pushing. Grit is not perfection, it's just not giving up when it's hard. That's
Yeah,
just
no,
what it
that's a really good way. And I like how you define it as a muscle as well. I want to
Yes.
ask you, have you read, I think the book is called The Power of Grit. Have you read that book?
I think I have. I think I have
Yeah.
read the book. I don't
I know
remember.
my husband has read it. I admit I have not, but I think it is I think it's supposed to be a very good book. So it's definitely something to recommend and read. So you
Yes.
mentioned grit, and you also talk about pursuing your dreams. So many people have
Yes.
dreams, but few take these bold actions. So what do you think separates the dreamers from the doers?
Fear.
Mm.
Yeah. It's fear of the unknown. And for some people, it's a little bit easier. And so I do not judge anyone who's afraid because sometimes the fear is legit. So if you have kids, you have a family, it's so hard to just pick up your family and say, oh, on the spur of the moment, I want to move to Dubai. Are you crazy?
Yeah.
There's so many moving parts. But at the same time, if you have a family, you have kids, I don't think the thoughts to move to Dubai would have crossed your mind that strongly. It would just be like a brief idea. There are still things you want to do that's still within your control at that point where you are. But I think it's fear. I'll give you an example. So many physicians are in jobs they don't like, and they're scared of leaving. And that's one part that I'm just like, no, you can work towards leaving this job. You're a doctor, you have your license, you have options, right? I remember when I was at a job that I didn't like. I had done all I knew to do to make it work. I had tried all the diplomatic skills that I had in the world. I had talked to people. And the last conversation I had, they said, well, why don't we? I said, okay, let's try for 3 more months. And then I got home, I realized, I said, no, I've been trying this. It's not going to work out. And I put in my notice. I didn't have another job anywhere. I didn't have anything anywhere. I didn't have like $1 million saved. That's my backup plan. But my backup plan was because my sisters are now back in the States. I was like, okay, if I can't pay my mortgage anymore, I would just move and go live with my sister. That's the worst thing that could happen, right? So that's it for me. But some people would stay at the job just for the security that it brings. But something has to give. Something has to give for the life that you truly want. There's sacrifices that you have to make for it. You may have to not have a lot at some point in time. Right now, I'm not pursuing clinical medicine full time. So I don't have all the resources I was having before when I was working as an internal medicine doctor. So it's a sacrifice I'm making for now because I'm hoping it would pay off in future. And if it doesn't pay off, I know I tried, but people are not ready to it's just that fear of just that comfort zone. You have your comfort zone, it's very predictable, you know what's coming in, you know what's going out, you have your system in place, and you're not ready to rock the boat. You just want to keep going at that pace. So for if so that it's just that fear that's what's holding
Mhm.
many people back. And when you start to peel up the layers, you find out that most of the things we're scared of, they're not going to happen if you just, and you don't have to be the most strategic person on earth. You just do not be reckless, but you don't have to have all the numbers, have everything planned out and say, okay, I know how much my grocery will cost me for the next 10 years. I have it all saved, because you don't, so many things could happen along the way, but just have like a big picture, and be ready to take that risk and try to find your support system. So for me, I know my support system is my family, it's my sisters. So if we go back to when I moved to the US, my sister co-signed my loan for me. So that's my support system. And I know now, I tell her all the time, if anything happens, I'm moving in with you. So find your support system so that when you choose to fly and it doesn't work out, okay, I have something I'm going to fall back to.
No, I like that. I think that's very good advice, having a support system, but also you kind of mentioned maybe you mentioned contentment basically
Yes,
in your
yes,
uh,
yes.
things that you teach. So how can you kind of balance this ambition and contentment at the same time?
Yeah, that's a good question. And it's something that's difficult to balance because there's one part of you who wants the whole world, and there's one part of you that should be ready to live with nothing. So this is how I see it. Personally, once I have my food, my clothing, my shelter, I'm fine. I can live on that. And at the same time, I'm still that girl who, when I'm flying, I fly business class. I like the good things in life. Even though I like the good things in life, they don't make me. I can do without them. Those are wants. So once I have my basic, the only time I'm not going to be content in life is when I don't have food, I don't have clothing, I don't have shelter. Then
Need
I'm
the
not.
support system too?
Oh. Oh, nah. See, I didn't think about that support system because I've never not had sisters. Like
Yeah.
yeah, they've been my, so now that I have to go think of that now and then come up with a new theory. But I think support system is important. If you don't have
Mhm.
support system, it's hard. And support systems, they don't have to be your family. And it comes in different ways. So I've been in Dubai a few months, but I have support system here. I have
Mhm.
people who keep me accountable. I have a friend who I haven't done a formal like a 10K or 5K or a marathon. She's keeping me accountable for me to run my first 10K. And this is someone I just met, but she's my support system. So
Mhm.
support system, it comes in different ways. So
Yeah.
we all have it. We even if you don't have it, you can create support system just by being a little bit vulnerable with the right set of people, right?
Yeah,
But
no, I totally agree. I think I like how you said the word vulnerable too. Like you're not gonna, get introduced and feel comfortable with people if you don't, put yourself out there and be
okay,
vulnerable, right? But I
correct.
think, yeah, that's amazing. So I think a support system is definitely added to,
It
the
is
things
added.
that you were saying. Yeah, for
Yes,
sure.
yes. So
So how if you're feeling content when you have your food, shelter, clothing, and support
I,
system, right?
yes, yes, I am content. That way I'm not moved. Because if I
Mhm.
don't have an extra Chanel purse, so what's gonna happen? If I can't
Mhm.
fly business class, so what's gonna happen? If I can, like, as long as all of those are just extras that we want. And so I have that internal contentment while I'm pursuing a life that's bigger than me. That's
Mhm.
just that I'm adding value to the world, adding value to people who come who are around me. But internally, I have that contentment that I'm good. I don't need 10 purses to be happy. I want 10 purses, of course. I'm not saying I'm not materialistic. I am, but that doesn't define me. But I don't think I will be able to think creatively when I'm hungry. I don't think I will be able to think creatively where when I'm not sure of where I'm gonna sleep tonight, or I have to go somewhere and then I don't have the right clothes to wear. I don't have to, it doesn't have to be the most expensive, but just something decent. So I think once I have my food, clothing, and shelter, every other thing is secondary. So I pursue that secondary thing from a place of contentment. And to be honest with you, when you have contentment, you're not desperate. And when you're not desperate, you tend to make the right choices because you're not, and you're less prone to making unnecessary mistakes because you're
Mhm.
not you're not desperate. And the difference between two people may have the exact same thing, but contentment will make one person not to make desperate mistakes, while the other who's not content would just keep hustling. Meanwhile, they don't know they already have what they need. You just want more.
Mhm. Yeah, I like that. So, in this whole journey and everything, well, what are you doing now that helps individuals? Tell us a little bit about that.
So you just asked what I'm doing now to help people.
Yeah.
So I teach women how to negotiate. So that's what I do. I speak at events. I'm working on my negotiation course. So I do like everything negotiation just makes me it just gives me motivation to keep going. I can never get tired of talking about negotiation, and when I talk about negotiation, it's not necessarily the last point where we are negotiating the deal that we want. it's
Mhm.
a it's a whole journey to get to that point. It starts from you choosing the right job, you showing up at that job with the right mindset, you looking out for people where you work, and then you knowing how to ask, you knowing how to position yourself as a leader, and then finally going for the kill when you need to ask for something. And so I teach women how to negotiate. I coach, I speak at events. So that's what I'm doing right now.
How does that, like your background, help you and define your new role with this?
So talking about background, so many things make up our backgrounds, and sometimes we do
Mhm.
not realize that some things from our backgrounds we take it for granted. I talk about my sisters a lot, right? So I'm from a big family. So we're 7 kids. I'm number 5. So I'm on the bottom of the food chain. So I was this person who they would send on these errands to my dad and say, "Go ask daddy for this," and I would go. And every time they kept asking me to go, and my dad is not like he's not the easiest person to ask for things because he would ask you all these questions. So why do you need that? Why? Okay, but I thought I gave you guys this the other time. So why don't you use this instead? Like he would have all those things. So before I go, I've already I already have the answers. I know that's gonna ask me this question, that's gonna ask me that question, and I have the answers. And I just kept getting better and better and better and better, you know. So it was a skill that I developed over time. And then when I was in my PhD program, I took classes on leadership and negotiation, and I kept reading books, and then the skill just kept getting better to the extent that the place where I just left, where I was working, so I was working 3 days a week. It was full time. I had more than 6, 7 weeks of vacation time, but it was just 3 days a week. I had so and then even when I was leaving, they said, "Oh, what can we do to keep you?" I'm like, "What else can you guys do?"
Oh my gosh. Yeah.
But
You
I was
definitely
able to.
negotiated a nice position there. That's fantastic.
It was amazing. And even now, they're like, "Okay, you can still come back to the US and work with us anytime that you want." So that was just, yeah.
Mhm.
So that's what I like to teach women. It's not because there's anything special about me. It's just how I was able to position myself. That's why I was able, and it was also the right environment, because you could be in places where you could do everything and it still would not work out. So when you have the right environment and you show up the right way, then that synergy is just something else.
Yeah, I like that. I like how you started with your dad. I think that's funny. Yeah. Yeah. There's also that book on negotiation. I'm trying to think of the name of it.
Never split the difference.
Yeah, that, of
His
course.
boss. Yeah, yeah.
Yeah.
I like that book. I do. But I'm not much of an actor, right? I'm not, so because there's something, and how would I describe it? And he's a hostage negotiator, right? I'm
Mhm.
not trying to release hostages. That's not what I'm doing here. I'm just that's a different ball game. That's life and death, right? Because he goes, there's so many good information he put out there that I practice. Then there's some stuff that's in there that I'm just like, you know what, that's not for me. He
Mhm.
says you have to use this voice. He has this voice that
Yeah.
I don't have it, right? I'm this girl who is from Nigeria and has lived in the US. My voice can never be like Chris Voss's voice. And he's a guy.
DJ, late night DJ voice, right?
Thank you. I
Yeah.
don't have it, right?
Yeah.
This is me. This is
I
it.
like
I
your
can't.
voice.
Thank you. So I don't negotiate as another person. I
Mhm.
go as myself, and I go based on how, if I'm happy and I like the people, then I'm all like chit chatty and laughing. If it's people I'm not comfortable with, then I'm a little bit more reserved. I am myself, right? And that's how I teach women. Do not try to take on another personality to go negotiate. The only thing you need to do is, not the only thing. One of the things you need to do is know what is it, what value do you bring?
Mhm.
Know your value, know what you know the value you bring, and then also know what you're asking for. And then
Mhm.
have your non-negotiables. So whether you go laughing, you go quiet, go as yourself. You just need to be very clear, and then be ready to make some compromise, but know what your non-negotiables are, so that when it's time to make compromise, it's not at that point you're deciding, you've already decided. Or you don't have to make that decision in time, at that point in time. It's something you can say, let me go back and think through this. But yeah, I
And,
don't.
also I would say like knowing what you want, because that could be a little bit different than what you're asking for, right? So like you
Correct.
said, the non-negotiables, maybe that would be the same thing.
Yes. Yes.
Okay. Well, this is amazing. Like your story is very powerful, right? Like learning to, use your muscle of grit to keep going in your endeavors to get all your collection of degrees. Is kind of like I like
Yeah.
to say it, because that's what I did. But and to continue to work toward your goals and your dreams. And it's amazing. So I really, thank you for sharing that today. Is there somewhere, well, let me ask you if there's anything else that you wanted to add, and then I'll ask how people can find you.
So I have a podcast, and when I end my podcast, I tell my audience that I truly believe they have the potential to be great. I think everyone has a potential to be great. Greatness for one person is not the same thing as greatness for another person. For one person to be great is just to be a really good mother. And then for another person, it's to be an astronaut. So it's a wide range, but I truly believe everyone has that potential to live a great life where they are truly happy and content with what they have. So that's my last message for your listeners, that I truly believe every single person listening has that potential to be great.
What one other thing I normally ask, and I think you answered it on our forum, but what is like one health tip for listeners? And your answer was very interesting because it tied in what you talked about today. Do you remember what you wrote?
Tell me.
It was more about the negotiation that is sometimes needed for getting patients to do their health screening and preventative care. Does that sound
Yes,
familiar? Yeah.
yes, yes,
So
yes.
it was a very interesting answer. I just wanted you to comment on that if you could.
So as for those of us who see patients in the clinic who need to do all of this screening, we negotiate with them all the time, right? And it's the simple things. Get your colonoscopy, and
Mhm.
you have to negotiate. And there was a time I had this patient, true story. I had this guy who came in, he didn't want to get his colonoscopy and all of that. We had this long conversation. I recall having a long conversation with him, and then he came back after. He was like, you know what, Dr. Simeme, I'm so glad you made me do the colonoscopy. I said, oh, really? He said, yes. I said, what did I tell you? He said, you called me a chicken.
That's
I'm like,
pretty
this is
good.
yeah,
Yeah.
he said I called him a chicken. So it's all of that back and forth that you go. It's all negotiation. I'm like, okay, what do I tell this person that would make him go get this? I'm like, okay, you scared? Oh, you're just a chicken. And then he was like, no, he's not a chicken. And then he went and got his colonoscopy. So it's all it's a back and forth. You find you try one
Mhm.
time, it doesn't work out. The next time you keep trying and you keep trying and you keep trying. So I strongly every people should get their screening test done. They should. It saves lives.
I agree. And I think, the colonoscopy thing is a great example because if I'm usually finding that a patient won't go do that, we do have alternatives, but it's still not the gold standard. But at least I can
Right.
negotiate to get them
The
something done,
Cologuard.
like a
Yes,
Cologuard.
yes,
Yeah. And
yes,
now we have a new Shield blood test as well. So, I mean,
yes.
there are other options, even though, I still obviously push for the
Right.
colonoscopy. And
That
then,
is
I
that is
might have to
something.
say, you're a chicken. You're not going to go do it. That's crazy. Yeah. And obviously there's like a vaccine outcry here. So, getting patients to do that is also kind of definitely a good
It's more
negotiation
and
skill.
it's more difficult now with the whole climate of, it's more difficult. There's less trust in vaccines now than before.
Yeah.
Not like it was great at any point in time, but it's worse now.
The sad thing
So
about that, I think, is the negotiation would take a very long time. Like it's not
yes.
always, it depends on the patient, but it's sometimes just you don't have that ability, the
Fine.
time to do that,
Yeah.
to negotiate
Yeah.
with that. But
Yeah.
these are really, really good life lessons you've got here. So thank you so much. And how can people find you?
I'm on Instagram. It's Gloria Esoimeme. I'm on Facebook. I'm on Instagram. I'm everywhere where they can find. I'm all on all the social media platforms. Yeah.
Awesome.
I have a
Yeah.
website. You
Well,
can find me on my
we
website.
website. Okay. Yeah, we will, as always, include all that information in the show notes. And thank you so much for joining us today. And everybody, get healthy, Tampa Bay, and stay tuned for next week.
Thank you for having me.
Yes.